Welcome. This research is part of a program of work developing a protocol for routine risk assessment and advice in the BreastScreen Victoria program called the Bravo Protocol. BreastScreen Victoria currently collects some risk information from 260,000 clients a year. For the implementation of risk assessment using the IBIS risk assessment model or any alternative model, additional information will need to be collected. The aim of this research is to gain insights from BreastScreen Victoria client-facing personnel on the feasibility of routinely collecting more detailed risk information from clients. For each individual risk factor, we ask personnel to provide insights about the ease or difficulty for the client to provide the information, client comfort, resource requirements, and how reasonable it is to ask this information at each screen. The survey was administered online using the REDCap tool hosted at the University of Melbourne. Here we show the median response to the statement about ease or difficulty in answering questions about each risk factor. Risk factors are listed in order of perceived ease, with the least difficult factor listed at the top. Difficulties cited by personnel are cultural and personal sensitivity around topics including weight and age of first live birth. That clients may not readily or accurately recall information, which means that they may have follow-up questions. And finally, that language barriers also make it difficult to collect information. Besides resources that help measure weight and height, personnel mention the need for specific information and/or training to discuss subjects like hormone replacement therapy medications. We note that those topics deemed to be difficult for clients to answer, like weight, correspond to the topics identified as ones that clients are generally not comfortable to discuss. Personnel indicated that it is also not reasonable to ask about these difficult topics at every screen. In addition, for some risk factors, personnel noted that it was unclear whether the information would be asked and that the information should be collected in person or via questionnaires. From the insights provided by BreastScreen Victoria personnel, we conclude that it should be made clear for each risk factor why the information needs to be collected, that the mode of information collection is important, and finally, that suitable training and information resources for staff are needed to ensure the quality of information collected, as well as client confidence in their overall risk assessment.